My pleasure on behalf of the investigators of the Empower 131 study to present the primary progression-free survival and safety analysis of a randomized phase 3 study comparing atezolizumab and carboplatin and paclitaxel or nab-paclitaxel versus carboplatin and nab-paclitaxel as the frontline therapy in advanced squamous non-small cell lung cancer. Squamous non-small cell lung cancer remains a very difficult to treat disease, and there have been very limited new treatment options presented to us over the last few decades. Approximately 25 to 30% of patients with non-small cell lung cancer have tumors that indeed can be classified as squamous cell carcinomas. First-line standard of care for these patients remains primarily platinum-based chemotherapy, and patients previously treated with frontline carboplatin and nab-paclitaxel have seen median progression-free survivals of 5.6 months, median overall survivals of 10.7 months, and objective response rates of approximately 40%. The Empower 131 study was designed to try and improve upon those numbers. In this three-arm study, patients with stage 4 squamous non-small cell lung cancer who are chemotherapy naive, as well as having any level of PD-L1 expression at the time of enrollment, were randomized in a 1-to-1-to-1 fashion in three arms. Arm A, atezolizumab, carboplatin, and paclitaxel. Arm B, atezolizumab, carboplatin, and nab-paclitaxel. And then the control arm, carboplatin and nab-paclitaxel. Patients received chemotherapy for 4 to 6 cycles, and then those patients in the atezolizumab arm remained on atezolizumab maintenance therapy compared to best supportive care until disease progression or loss of clinical benefit. The primary endpoints were investigator-assessed progression-free survival and overall survival, with secondary endpoints of progression-free survival and overall survival in the PD-L1 subgroups, overall response rates, and duration of response, as well as safety. In this study, we witnessed a doubling of the 12-month landmark progression-free survival rate for patients treated with atezolizumab and chemotherapy versus chemotherapy alone arm. Progression-free survival in the control arm increased from 5.6 months to 6.3 months with a hazard ratio of 0.71. So patients that received atezolizumab had a 29% reduction in the chance of progression or death while on study, which translates into a 12-month progression-free survival doubling from 12% in the control arm to 24.7% in the atezolizumab arm. Progression-free survival benefit with the atezolizumab and chemotherapy versus chemotherapy alone was observed across all PD-L1 subgroups. In the intent to treat patient population, again, I mentioned previously, 5.6 months median progression-free survival increasing to 6.3 months, which is the final point in the plot here. And then I draw your attention to the second point, which is the PD-L1 high-expressing patients whose progression-free survival increased from 5.5 months to 10.1 months with a hazard ratio of 0.44. Increase in confirmed objective response rates and duration of response were witnessed in the atezolizumab and chemotherapy arm versus chemotherapy alone arm across all PD-L1 subgroups. Again, I draw your attention to the far left of the graph, which is the intent to treat population, with response rates 41% in the control group, 49% in the atezolizumab containing arm. And this translated into a median duration of response increase from 5.2 months to 7.2 months, with ongoing response rates doubled from 16% to 32%. Greater differences were even seen in the PD-L1 high, with response rates increasing from 33% to 60% in the PD-L1 high subgroup, with median duration of response increasing from 5.3 months to 18.7 months, and again, ongoing response doubling from 25% to 53%, which was also witnessed a doubling of the ongoing response in the PD-L1 low subgroup of 11% to 25%. In this first interim overall survival analysis in the intent to treat population, that is all patients, atezolizumab and chemotherapy versus chemotherapy, we did not witness an overall survival difference, with control arm of 13.9 months median overall survival and 14 months in the atezolizumab containing arm. In summary, the Empower 131 data demonstrates that patients with advanced squamous non-small cell lung cancer benefit more from initial treatment with atezolizumab plus chemotherapy than from chemotherapy alone, with 29% of patients having a reduction in their disease worsening or death with a combination versus chemotherapy alone. and a doubling of the 12-month landmark progression-free survival benefit was observed. That is, cancer had not worsened in 24.7% of patients receiving atezolizumab plus chemotherapy, compared with 12% of those receiving chemotherapy alone. And this progression-free survival benefit was observed across all comers, that is, all PD-L1 expressing subgroups, and was enriched in subgroups with higher PD-L1 expression. Atezolizumab and chemotherapy does have a manageable safety profile consistent with the known safety risks of the individual therapies, with no new safety signals identified in this study. Overall survival does continue to be followed, with the next interim overall survival analysis anticipated later this year. Thank you.
All right. Thanks very much, Dr. Jotte. There's so many of these PD-1, PD-L1 drugs that are now FDA approved for treating lung cancer. It's getting a little hard to keep track of which drug to use and which type of lung cancer and which line of therapy. So I'm going to ask Dr. Graham to help us sort it all out.
Thank you, Dr. Oshilsky. This report dramatically broadens the group of patients with squamous cell non-small cell lung cancer who can benefit from the addition of immunotherapy to chemotherapy as frontline treatment. We previously thought that you needed a high level of PD-L1 expression to get the best results from immunotherapy. The results of this trial, the largest randomized trial to date in this population, show that that is indeed not the case. Benefit of immunotherapy was seen across all groups. For a person undergoing chemotherapy for advanced breast cancer to hear that their disease has progressed is devastating to them. What we see with the results of this study is that we can actually double the chance that they don't have to hear that bad news in their first year of treatment. The overall survival results are immature. We hope that the results seen in progression-free survival translate to improve overall survival. If and when that's shown, I think we'll clearly have a new standard of care for the frontline treatment of squamous cell non-small cell lung cancers.